being a patient really opened my eyes, and that's the only thing I could really do at the time when I was in a hospital bed paralyzed. My brain was working and my eyes were working.
Sven Gerlinger, Chief Experience Officer at Northwell Health, spent months in a hospital bed paralyzed, and during that time it was the human interactions and spiritual guidance he received, as well as the love of his family, that helped him get better. He learned a great deal about what was important to patients by being one.
I had Guillain-Barré syndrome, and I found myself in a hospital bed for 3 months, and with a very uncertain future at the time, with varying prognosis, and it's a difficult time to go through. And for me, it was a time to reflect on life. People that really were sensitive to my physical needs, to my emotional needs, were the ones that I remember fondly. And most of them that were the great employees that I think about are the ones that related to me. They built a relationship with me, and I still remember them today.
For Sven, it was what might seem like the little things, like having someone give him a shave, that meant the most to him. At a time when he couldn't do much for himself, those elements that made him feel more like a functioning human made a big difference. Those experiences have shaped how he and the North Shore LIJ Health System approach healthcare.
One of the core concepts of patient and family-centered care is trust and dignity, which involves that we listen to our patients, that we take their preferences and take their beliefs into consideration, and then make sure that we incorporate that into the care plan.
To try and cater to many different religious beliefs and cultures, Northwell Health has created many services and programs, including halal meals for Muslim patients, meditation rooms, Holy Communion distribution, bloodless surgeries at Forest Hills Hospital, and prayer services for several religions.
And then we have a lot of different services available to our patients, from the Shabbat elevator for our observant Jewish population, to various kosher meals for the patients, interfaith chapels and interfaith services for the patients and family members. One of the recent additions we've put in place at LIJ Medical Center is a wudu room for our Muslim population to prepare for prayer and to prepare for the reading of the Quran.
Northwell Health also has several chaplains throughout its facilities to help people with any spiritual or emotional needs they may have during their hospital stay.
Chaplains are a huge part of our health system, part of the patient experience. They are a safe haven, I believe, for the patients. They are able to provide our patients and families with comfort, with hope also, and they can be a great conduit to all the other services that we provide.
Meaning a person's spiritual needs can also affect their physical outcome during a hospital stay or other medical treatment. Patients should feel free to express how their spirituality might impact their treatment preferences and what kind of services they would like to receive.
With certain cultures and certain religions, it is somebody else speaking for them, and they can feel free to do that. But it's also, we need to build the relationship with the patient, and if we know who they are and where they came from and what their goals are, and we can help them open up, actually. And that's a key aspect of building the relationship with our patients, to make sure that they are comfortable. It's very difficult for a patient to evaluate the medical experience, the medical knowledge, all the great things that we are so proud of, but it's very easy for them to evaluate how they were treated and how we treated them as a human being. And that's treating a patient and their family as a whole person is important to do.